A very good morning to you, and welcome to our Glaucoma Awareness Program, which is in partnership with the Eye Specialist Hospital. And we welcome you to a program that have answered a lot of questions and continue to answer questions. And today we are having a sort of interactive session where, of course, the aims and objective is to answer questions frequently asked by patients and the general public about glaucoma. Of course, do well when the talk lines open to also ask your own question. That means there will be not much talk inside here. We will want to look at your questions, and it's very important. Now, and of course, glaucoma has been called the silent thief of sight because it develops without early warning signs, yet its impact on vision and quality of life can be profound. To help us better understand these conditions, we're privileged to have with us Professor Nkira Kariwe, a renowned consultant ophthalmologist, and someone you could call, I think, the African governor, right? How do you,
The governor for Africa, World
okay,
Glaucoma Association.
beautiful. Okay, so she will be answering frequently asked questions and shedding light on how we can prevent, detect, and manage glaucoma. This promises to be an engaging and interactive session. Good to have you, Prof.
Yeah, great to be here.
Okay, so let's start. We don't get tired of saying what glaucoma is
At all.
because they're always first timers on the radio. So, what exactly is glaucoma?
Thank you very much, you see. And thank you, dear listeners, for always tuning in and also for informing your social network to tune in and get to know about this silent thief of sight that gets to damage our eyes without our knowing. Now, glaucoma is a condition, it's a disease, a group of diseases actually, that damage the nerve for vision gradually and slowly.
Hmm.
And it does it in a characteristic way, that damage, and there are many things that predispose someone to having that. And that characteristic way it damages it helps the doctors to know, okay, this is glaucoma. And there are also some tests that when they are done, there's a characteristic pattern of
Hmm.
damage that helps us to know that this is glaucoma. Now, so the main thing is that glaucoma is a damage to the nerve for vision. Now, for the sake of those who don't understand what the nerve for vision does, it connects the eyes which you're seeing to the brain.
Hmm.
Now, when a child is born, a child begins to code. The brain is like a computer, begins to code things. Oh, this is a car. When you're told this is a car,
Hmm.
the child sees the shape and codes it. You say this one is a lorry. You
Okay.
say okay, the child codes it. So like that, that is how life is. From seeing, that child codes things. This is Auntie Rose.
Okay.
This is Mommy Nkiru.
Hmm.
This is Uncle Ben. The child codes it. So the next time the child sees Uncle Ben, the rays of light enters the eye and travels to the brain,
Hmm.
and the brain says, this is Uncle Ben. And
Okay.
it happens in such milliseconds, the child say, oh, Uncle Ben,
Hmm.
because it's been coded. Now, the connection between the eye and the brain is that nerve. And that's the nerve that glaucoma
Wow.
damages. So it's like the switch and the bulb. So there's wire between them. And if the wire is cut, then you put on the switch, the light doesn't come on.
Hmm.
So that's what glaucoma damages, that wire. And so the eye is looking at the
But it
objects,
can't see
but
anymore.
it can't see anything because
Hmm.
there is no interpretation, there is no connection. It didn't connect to the brain. So glaucoma damages that nerve slowly and painlessly.
Hmm. Slowly and painlessly, so you don't even get a feel pain.
You don't get to feel
Okay.
anything.
Is glaucoma the same thing as high eye pressure?
It's not the same thing.
Okay.
Like I said, that there are conditions that predispose someone to having them. One of the first things that predispose anybody from having glaucoma is high eye pressure. So, and we call them risk factors.
Mm.
So, somebody can have a lot of risk factors for glaucoma and develop it, or might not. Okay, so but if you, the more risk factors you have, the more likely you are to have.
Mm.
So, high eye pressure is the is a major risk factor. Okay, when it's raised, somebody is more likely to develop glaucoma.
Mm.
But there's glaucoma even without the pressure being high, and
Okay.
we call it normal pressure glaucoma.
Okay. So I'm 48 and felt very fine. But during a church health walk, the nurse said my eye pressure was high. I didn't believe it because I see clearly. My wife says I should ignore it. Doctor, if I feel nothing, why should I worry about glaucoma?
Thank you very much, because this question actually is what so many people fall prey to, and it's so important to know, and that we said that glaucoma it has a nickname, the silent
Thief
thief
of
of
sight.
sight, meaning that you will not feel anything. You won't know that something is wrong. So the pressure might be high, the pressure might also not be high, and damage is going on,
Hmm.
and you are not aware. The reason is that I mentioned when I was explaining what glaucoma is, that glaucoma damages the nerve in a characteristic pattern. Now, glaucoma usually damages the outside of how one sees. That's what we call
Yeah.
peripheral.
Okay.
Okay, so the center vision is preserved till late in the very advanced stages. So the side vision is going gradually, and because it's gradual, the person doesn't know. If somebody wakes up and all the side vision wakes up overnight, it's gone suddenly. They will notice it.
Yeah.
But when it is a gradual thing, the brain adjusts to it, and the person thinks it's normal. So the person doesn't know who has glaucoma until advanced stages, when that center vision is being touched. Up to 90-95% of the person's vision nerves have been damaged. So you don't want to wait till you feel something. By the time you start, when glaucoma is in an advanced stage, you start having smoky vision, dew. It's like there's dew, is blurry. When any patient enters the clinic, say, it's as though there is dew. I say, oh my God,
Mm.
because you just go sad, because that dew won't go. When it has come, it has come.
Mm.
It's not going. Whatever treatment we give, that dew remains. That smokiness remains. So you don't want to get there when it is giving you sign, because it's at an advanced stage.
Each time I think of glaucoma, I think I want to thank God for pain. Because if
Exactly.
something happens to you
You,
and you
you
feel the
know
pain,
exactly. At
uh,
least you know there's a problem. I
but
mean,
this
that's
one
true.
it will just damage your
I'm
eyes
telling
without
you,
you
you
knowing.
don't you knowing.
Now, is it possible that glaucoma can affect both of my eyes at the same time?
Yes, usually it's a bilateral disease.
Hmm.
Bilateral means it affects both eyes. Some lucky chaps who have glaucoma, one eye might be advanced more than the other.
Okay.
But some, it just goes together,
Hmm.
almost the same, almost at the same pace. Maybe one eye is 99% damaged and the other is 95% or 97% damaged. So it's almost close. But there are some people you will see, one is 95% damaged and the other is 70%. So those ones, you want to, when they are even complaining, you say, just thank God that you
Yeah.
have one good eye. I'm telling you. So it affects both eyes usually,
Hmm.
except the secondary glaucomas. The secondary glaucomas are the ones that are caused by something, maybe like something hits the eye
Hmm.
and all that, or somebody is overusing the drug we call steroids. then that can affect only one eye.
Okay.
Mm.
All right. Let's find out. Can a child be born with glaucoma?
A child can be born with glaucoma.
Hmm.
Glaucoma affects all ages from birth to death.
Hmm.
It's just that it's more common as one gets older.
Okay.
So the 80-year-old is 5 times at greater risk of having glaucoma than a 40-year-old. But 40-year-olds have it, 20 have it, 2 years have it,
Hmm.
birth they have it.
All right. My child was born with large watery eyes.
Mm.
My baby was born with unusually large eyes that water all the time, and he hates light. Someone told me it could be congenital glaucoma. Is that a real condition in babies?
It's a rare condition, and the description given is typical of what congenital glaucoma appears
Hmm.
like. And so we want to say to the mother out there, and to the grandmother, and to the neighbor, when you see Mama Ngozi and Mama Esther, and the baby has these symptoms: large eyes, watery eyes, doesn't like sunlight, please don't tell the child, don't tell the mother, some babies are like that, don't worry yourself. Please tell them, go and see an eye doctor, because those are usual, typical symptoms of congenital glaucoma.
Wow. So that's a very serious one for little children.
Yeah.
Is glaucoma a disease you're born with, or does it develop later?
um you're not born with it, except it's the congenital type.
Okay.
Okay, but it's something that gets developed. I mean, people develop it with time. So there are those you're born with, and there's people who develop it at a young age, 4 years old, 5, 7, 8. And we've done surgeries for all such children, and all like that through life. So somebody might not have it until maybe about 30 years. Somebody might not have it, and then they develop it around 40 or 50 or 60. So you can be born with it, and you can develop it along the line anytime in your lifespan. And the fact that they checked you yesterday, last year, and you didn't have it, doesn't mean that this year you won't develop it. So
Okay.
it's a continual check you do throughout life.
Does glaucoma only affect the eyes, or can it affect any other part of the body?
It only affects the eyes, but there are other conditions, disease conditions, that have glaucoma as part of it. Do you get? So those other conditions can also affect other parts of the body, but glaucoma is just a condition of the eye.
One of the myths people have is, let me not just find out I have it. So even if I have it, let me just have it. Or they believe that I can't have it. Like some of our brothers, they say it's not my
It's
portion.
not my portion. Yeah, it's and we want to join you to say amen. But please just check.
Just check.
Just check. The people that have it's not because they committed any
Mm.
sin or crime. You know, glaucoma is no respect of persons. You just check, please. Just check. Just check to confirm that declaration you're making, that it is on the right side. Please just check.
Okay, in case you just joined us, we're looking at the frequently asked questions about glaucoma. And if you want to join the glaucoma WhatsApp channel, send glaucoma to 0810 435 8093 on WhatsApp so that you can be added and learn more about glaucoma. Don't send a message as SMS or text message. You can chat up 0810 435 8093 on WhatsApp. Okay. If you're out there and you're listening and you have a question you want to ask Prof, you can also call in 0909 771 1009 or 0902 0902-311-1009. Let's get your questions. Hello, good morning.
Hello, good morning. You say
Good morning.
night by
All right, let's hear you. Go ahead.
Yes, yes. I want to ask if somebody something is flying out from somebody eye, black, black, black. What does it mean?
Okay.
You are looking, something is coming out from your eye. It's only flying like flying, but it's coming out as a black.
Okay. Noted. We'll take some more calls. We will respond to them. Hello, good morning. Hello, good morning. 0909-771-1009 or 0902-311-1009. You can write down the questions so that you can take them in one swoop. 0909-771-1009 or 0902-311-1009. Okay, let's start with that one.
Quite get the
He
question.
said, if something black is coming out from your eyes, what could it be?
I wonder which part of the eye something black is coming out from. I mean, if it's a discharge don't look black, so it don't look black.
Okay, Babochi, you might want to call back and let's get some clarification. Medicine is not something you use speculations to attack. So do call back and explain exactly what happened. 0909-771-1009 or 0902-311-1009. Hello, good morning.
Yeah, I'm back again.
Okay.
You see, my two eye was affected on that. Before I come to cataract operation, one of my eye.
Okay.
So the other eye, the eye that I do cataract stopped. But the other, my right hand, my right eye, when I'm you see black, something like black coming out.
Coming out from your eyes.
Or he's seeing it inside the.
That is.
Is it coming out or he sees it? Which of them?
That is. Let's get it clearly. You had a cataract surgery, right?
Yes.
On your left eye.
Yes. I think
then on the right eye, something black comes out. Is it like tears?
No, not black. In the block form.
Is he seeing it?
It's just flying.
Is it that you're seeing it? You're seeing something black?
Yes.
Okay.
You're seeing something black or something black is coming from your eyes?
He's seeing something black.
Yes, but it's not steady. It's just the fly.
It moves around.
Okay.
I understand.
Okay, she understands what you are saying. Hello, good morning. Hello?
Good morning, sir.
I can't hear you.
I said good morning. Good morning.
Put your mouth in the mouthpiece so we can hear you.
Good morning, sir. Maybe it's network. Let me go outside.
Is your phone? Raise your volume. Is your phone?
Hello? Okay. Are you hearing me now, sir?
Go ahead, we'll manage.
Hello? Good morning, sir. I'm Jennifer, sir. I'm calling from Enugu. Sir, good morning, ma.
Morning.
My question is, ma, I'm one of your patients, ma. Understand? But at the point, you understand, there's a time you actually gather money to the operation, but I couldn't get the money then. You understand? Because I have fired the contract that time. So at the point, there's no need to get money what to get to understand me. This case is the first then. That was last 2023, you understand? And 2024. So now I'm about to say that I have got blind, you understand? So there's another doctor, one doctor that used to help me, giving me tomorrow. But I know tomorrow is no longer at fault with my situation, understand? But this is what they can do. So at the point, the eye has now got blind. And before it has been giving me headache, but now that I have got blind, it's no longer giving me headache. See any problem? Am I safe now? Understand me? Because I don't need any problem longer. There's no need to say. Thank you, ma.
Okay. You got her. Hello, good morning.
Hello, good morning.
Good morning.
It's Angela.
You're welcome. Go ahead.
I just want to appreciate you. I just want to teach you this one.
Why are you always sounding like you're crying?
It's, it's just my voice.
Okay. Okay. All right. You have a question for Prof?
Okay, Uncle Yusuf, it's about the thing I told you.
Okay.
There's someone in Lagos when they are training people for hard work. You can learn fashion designing, and if you want to make NAS, all these bonds with detergents they use to wash dishes. Then I have decided to learn the fashion designing. That is
Okay.
my fashion before I get blind.
All right. We'll talk about that off air. Let's focus on what we're doing right now. I'll talk to you after. Hello, good morning.
Hello. Good morning, you CDNC, and he's also in the studio.
Yeah, good
Good
morning.
morning.
Okay. He's also the chemistry teacher calling from Molo in the local government area.
You're welcome.
So I'm directing this question I want to ask to the doc in the studio. Doc, is the nerve position the same thing with the optic nerve? That is one question. So another suggestion I want to make is that is there any way that this, because I know this Glaucoma awareness program is a nice program that it will introduce on this radio, and it's teaching us a lot, we're learning a lot. But is there any way this program can be made so that there will be Igbo version of this program, so that many people will be carried along? You know, as we're using English to interact in this program, those people in the rural areas, some of them, many of them will not be carried along. So if we can develop a way that we can have the Igbo version of this program, it will be of a great help to many people. Thank you.
Okay, Osmond, you should just pay in some money. That will help us to get the Igbo version on. Tash is doing a whole lot of job trying to do the sensitization. So those who are well-to-do and who care about the people should lead the way. This one, if you know how much it's costing, but it's okay. It's okay. And I don't know whether Prof can say what she's saying fluently in Igbo. Okay, so that's another kettle of fish. But then your concerns are noted. Okay, Prof, let's take the questions we've gotten already.
All right, thank you very much. Let me start with our first caller, who's asked about a black something. It's actually, we call it a floater. It's like you're seeing something black. Different people see it. Yes, sometimes. So you would think that there's some dirt in the water sometime at the beginning, and you pour the water away. You get another cup, and you still see it inside, and then for some it moves, because it moves around. It's like the thing is flying. You want to catch it, only to see that there is really nothing. It's inside the eye. Now there's something inside the eye that is like gel, thick gel. Is called vitreous. At times that vitreous breaks down into its component parts. And when it breaks down into its component parts, some parts of it are patchy and dark. Okay, and so it's inside. So it's only that person seeing it. For some, they get quite afraid. It's like they are seeing spirits. Yeah, so, and usually it's not a big problem. But occasionally, maybe 3 out of 100, it could be a prelude to what we call retinal detachment. So it could retinal detachment is a blinding condition. So it could be the first steps towards that. So if you see that, generally there's often no problem. But if you now see multiple of them, all of a sudden see the nearest ophthalmologist as an emergency. Yeah.
And he has already had a cataract surgery.
Yes, so, but usually that's one big one floating around is not a problem.
Okay.
Usually, yeah.
Okay.
Then the second patient, the caller, talked about that she was scheduled for surgery. She couldn't looking for the money for surgery, and the eye got blind. It's a painful thing, and since after that, no more pain. There's a time we say the devil at work. Before the eye got blind, it was paining her. Now it's no more paining her. Now, the issue she's brought out is a heartbreaking one, and that is that someone goes blind looking for money to do surgery. And we really call out for good spirited individual who would want to save an eye out there. Interestingly, a patient of ours heard us on radio here calling out saying that, look, somebody, people who have need, and the person sent in some money, to support anybody who has need for to have surgery. So when we see the next person who who needs surgery and who is confirmed to be indigent, we will do something to help because somebody helped. There's also an extent that the doctors themselves can do. If you look at the scriptures where we had the Samaritan, the Good Samaritan was not really the same person as the innkeeper. The innkeeper was the one giving the treatment. The Good Samaritan was a businessman who was on about his business and deposited some money, say, take care of him, treat him. When I come back, if there's anything remaining, I'll settle the bill. So we are reaching out to people out there. We know people have. Just invest in somebody's life. If you want to know who benefited from you, we can give you that contact. If you don't want to, God sees it,
Yeah.
and will bless you for it. But it might save somebody's eyes. I've seen that instance, that occasion now and again. Somebody goes looking for money to do surgery, and by the time they come back, the eye is gone. Remember that before they came, it's at a very advanced stage, and you're saying, look, you need surgery. In fact, by yesterday you needed this surgery, and then they say, okay, doctor, and you don't see them. Then they come back 3 months later, 5 months later, sometimes 9 months or 1 year later, and that eye is gone. So this Jennifer who called, perchance your other eye is still good. I want to encourage you, please come and have it checked, so that it can be prevented from going blind.
Yeah. Is there any
And
other
then the
question?
last one is the nerve for vision, the optic nerve. Yes, exactly. That's the name for the nerve for vision. Optic nerve is the name. And for the Igbo version, yeah, we are well and able. If we are asked to do an Igbo version, we can deliver the information in Igbo.
Okay.
Yeah.
All right, welcome back. We can take more calls. We can also take more questions. And let's notify you that you can have the Tesh contact number 0809 036 0000. 0809 036 0000. And there's also a WhatsApp channel that you can join for more information about glaucoma. 0810 435 8093. All right, the talk lines are still open. 0909 771 1009 or 0902 311 1009. Hello, good morning.
Good morning, Uncle Yusuf.
Yeah, good morning.
Uncle Soldier.
All right, let's hear you.
Okay. My own feedback is that the two eye, even the right eye, is no more making use of. The left one, I'm seeing small through that side. But every time I want to back, if I forward out my body, one corner of the left eye will just be like that. They see where the cut is for that my eye. So But the other right eye, I know they even use that one for making use of that one for anything. The remaining one, as much as they see for inside, that is that for my own. And another problem I have is that I need phone, just like Android phone to download the app where I go take the button phone where they use. It is very difficult thing for me. When I talk some people to make confirmation, I will tell this I'm busy, I'm behind. So it will make me, even if I have emergency call to call, I will not make that call to the people who help me find the number out of my phone. That is why that day I asked you where I will drop if I want to call Solid FM. I need to can come physically. That is my own problem. Thank you from also.
Also, yeah, good to hear from you. Hello, good morning.
Hello, good morning.
Yeah, good morning.
Rob, good morning.
Good morning.
My name is Judy. I'm calling from Chelsea. I just called to you, Prof, for all the good things she's doing. I was given the opportunity to listen to a program you people held last week. And I'm free that you're even doing counseling work. God will bless you, man.
Thank you very
God
much.
bless you too for what you're doing. Have a blessing.
Amen.
Thank you.
Thank you.
All right, keep the calls coming. 0909 771 1009. This is your opportunity to ask your question. Hello, good morning.
Hello, you see James and the doc in the studio. He's also still calling back.
All right.
So I want to ask the doc this question. Are there natural ways we can lower eye pressure for glaucoma without applying orthodox eye medication?
Okay.
Yes. Thank you.
All right. Hello, good morning. Hello. 0909 771 1009 or 0902 311 1009. Hello, good morning. Hello. Why is your phone always low? It's very low. You can hear other people.
Maybe it's network problem, sir. Eh? Okay, it's button phone on the side. Maybe it's the phone, huh? It's not okay like that again, sir. Are you hearing me, sir?
We are barely trying to hear you. Go ahead.
Okay. Okay. I say I call back. All my complaint is on headache, understand? Used to give me severe headache, but I don't even touch my head then. But now, understand, the pain has decreased. So I'm even asking, am I safe? Understand me? Is there anything, understand me, to please do about it? Or should I be, great things are now, understand me? Things are not normal. I must tell you. Things are not okay for me, understand? We are surviving by the little thing my children is getting from selling pure water. So I was like, that very headache is my state. If the eye has got blind, am I safe? You
Okay.
cannot see anything.
All right. Hello, good morning. 0909 771 1009 0902 311 1009. Keep the calls coming. Okay, Prof, let's take
Yeah,
this
you know,
round of.
yeah, I would like to say that glaucoma, we say usually it's symptomless. Glaucoma, the common glaucoma doesn't give headaches. If it is, there's a type we call acute angle closure glaucoma. That type can give terrible headache. That's the type of headache you can't talk. Okay, but if it's glaucoma, the common glaucoma, no headaches. So the fact that she says she has headaches is something uh, to think about. There's a condition of a brain tumor that gives headaches and that can look like glaucoma. And that brain tumor can also actually coexist with glaucoma. Okay? And that brain tumor is a pituitary tumor. It's called pituitary tumor. It's usually under a restriction. And so because it's causing headache, when it breaks through that restriction, the headache stop.
Hmm.
So it's important.
That is she safe?
Yes, so it's important Jennifer really gets reevaluated to make sure, is it just glaucoma you had, or is it glaucoma coexisting with a, we call it a paracellar tumor, with a maybe a pituitary tumor. Why would you be having headaches? And then stop. And at that stage, and that condition also blinds the eye
Okay.
because the nerve for vision crosses around it. I don't know if you get me. Yeah. So please get re-evaluated to be sure that you're really indeed safe. Especially, I mean, and she's wondering why. Now the eye is blind. Then the headache has, is she safe? So please get re-evaluated. It's very important.
So you know exactly what condition
Yes,
you're
yes.
in. Let's take the other ones.
Okay, someone asked that is whether there's some other natural ways to lower the pressure apart from the orthodox ways. Well, there's the aspect of bitter cola that has been tried, but bitter cola was also processed, in the orthodox way to get an eye drop.
Okay.
And but the extent of its low eye pressure lowering effects is actually a bit less than that of what is ordinarily available. So that's why it didn't fly. Okay. And then there are a few other things one can do to lower pressure, like we talked about in some episodes ago. Reduction of stress. Stress increases the steroid level within the body, and that steroid body has effect of increasing the blood pressure. So you can reduce your anxiety level, reduce your pressure, reduce your stress level, and all those things can have effects on the eye pressure. But that doesn't mean that if you need eye treatment, that is enough to handle the treatment. So please let that caution be there before somebody will say, I'm now relaxing, then so the glaucoma will no more come. So please still have your checks done. And because when glaucoma comes, there's a level we need to reduce the pressure to for it to be safe. And that's one major reason many people lose their eyes. They'll be using eye drops, and the pressure has not come down to the safe level for that particular eye.
Okay.
And so damage still goes on. They are using drops and damage is still going on until the eye gets blind. So don't be comforted, oh, I'm using drops, so I'm getting treatment, nothing will happen. No. Okay. And then in this case, maybe you're not even using, say I'm just relaxing, and so please just take note of that. I don't know if there was another question.
Okay. If there's none, we can take some more.
Okay.
Just maybe one or two. 0909-771-1009, 0902-311-1009. If you have a question, let's get it. Hello, good morning.
Good morning, sir.
Good morning.
Prof, good morning.
Good morning.
Please, I've been suffering from glaucoma for the past 13 years.
Okay.
I've been using drugs, but I want to visit the prof at his place to see what he can do for me, how he can help me.
Okay.
I want to know his place, his place of residing, his hospital.
All right.
So I'm living at Ochi River.
Okay, we will drop the address before we're done.
Okay, thank you, sir.
You're welcome. Hello, good morning.
Hello, you see the question I asked, the doctor has not answered my question.
She answered.
I asked. Are there natural ways we can lower
she answered you
for glaucoma without applying orthodox eye medication? That's the question I asked, and she has not answered that question.
Have you been listening, or you went away?
So I asked the question, are there natural ways
we got your wait now. We got your question, and she answered it. Unless you're not listening.
No, maybe I was not listening. Sorry, I would like her to repeat that answer.
Okay. Okay. Because she answered you. You could say I did not hear it. Okay, sorry for the stress, but you have to repeat yourself. Okay, for the man that called from Ojiriva, the eye specialist hospital is at 12 what? 11. Okay, 11 Church View Street. That's opposite Old Adoration, okay, in GRA. And then, of course, you can take this number to 0809 036 0000. 0809 036 0000 in case you need more clarification. Go ahead.
Now, I was saying that it can also come to the ESU Teaching Hospital,
Okay.
Parkland. Yes, you know where it is in Jerry.
Okay, so let's attend to Osman.
Okay. I was saying that there's certain things like um, bitter cola that has eye pressure lowering effects, but usually you also have to instill it in the eye. And for it to be safe, it still has to be scientifically handled so that you're really sure of what you're doing. And that the research done, the eye pressure reduction effects of beta cola was not up to that of the other orthodox ones available, and so that is why it didn't fly. Also, the same thing with marijuana, it also reduces pressure, but it's also a mild reduction. Okay, so you can't go and start taking weed so that your pressure will reduce for just maybe say like a very small percentage when you have orthodox medications that can reduce it. Then I talked that can reduce it much better. Then I talked also about the place of sleeping and the place of adequate sleep, the place of rest, the place of um, decrease anxiety and stress. Okay, and some time ago we had talked about it, the place of meditations in reducing eye pressure. But we are saying that when you're doing all these things to reduce the pressure, it's so important to keep a scientific check on what the pressures are, so that there is not that they are enough on their own just to reduce the pressure. Okay, but whatever you're doing, they add to it. So don't, there's no contradiction between these things and the orthodox one.
All right, let's take one more call. 0909 771 1009 or 0902 311 1009. If you're quick, we're running out of time. Let's also remind you, you can join the WhatsApp channel to know more about glaucoma using the number 0810 435 8093. Hello, good morning.
Hello, sir. Oh, please. I called back, Jennifer.
Okay.
Please stop, as on the variation you talked about, I don't know how to do it because financially, you understand. And my fear was like, for this not to affect the little children I have, understand? In terms of finance, and it didn't any problem, there's nobody to understand. I don't know how to come about it by
Okay. You really need to look at your phone, raise the volume. It's about a certain, I don't think it's network, so that people can hear you loud and clear. All right, Prof. You might respond to her and then closing remarks.
All right, I think you can come to the hospital and ask to see the manager. Okay, she will give you some assistance. All right. So I hope that solves your problem.
Mm.
Okay, then I would like to encourage our listeners, as we've discussed today, that glaucoma is a chronic condition that damages the nerve for vision, which is called the optic nerve, and it does it slowly and most times painlessly. And so that is so important, and it can affect any age from birth to um, death. So don't, they say that because you have no symptom, because you're seeing well, you don't have glaucoma. You might have lost 80% of your nerves, 85, 90, and still seeing 6-6. You have 6-6 vision. So the wise thing to do is go and check. We keep saying, please go and check. Every year, go and check. Every year, go and check. It is wisdom, you know.
Thank you, Professor Nkira Kaiwe. It's been awesome. Remember, if you want to get to Tesh, you can use the number 0809 036 0000, and they will attend to you. Thank you for joining us, and do join us again next week for another beautiful edition of our glaucoma awareness.